Hi everyone, my name is Armando Mendoza. This is my assessment plan for Health Services Center. The Health Services Center is a nonprofit medical clinic located in Hudson City, Alabama. They specialize in serving in rural communities, providing a full continuum of HIV prevention and medical care. Some of their key services includes HIV testing, counseling, PrEP access for HIV prevention, STI screening treatments, um, condom distribution and risk reduction education, case management, adherence to support, and mental health services for individuals living with HIV. They also help with housing, transportation, and food assistance. And these services address both the medical and social determinants of health, which are critical for individuals in rural area with limited resources and significant health disparities. The purpose of this assessment plan, it aims to identify community needs related to HIV prevention and care, as well as to analyze those current services delivery capacity at the Health Services Center and understanding um, rule-specific barriers such as stigma, transportation limitations, and low awareness, and determine where gaps exit in HIV testing, PrEP use, education and support services, and guide future planning resources, allocations, and program development. This plan is entirely focused, not evaluation focused, and it seeks to understand what exists and what is needed and what must change to better serve rural East Alabama. The Health Services Center's mission is to provide a high quality, affordable, and accessible medical care as well as supportive services to individuals living with or who are at risk for HIV/AIDS, regardless of their ability to pay. So their key mission priorities include reducing HIV transmission, improving health outcomes for individuals living with HIV, increasing access to HIV prevention services like PrEP, and strengthen the overall public health infrastructure in rural Alabama, as well as addressing those housing, transportation, and mental health needs. Stakeholders, internal stakeholders play a huge role in shaping services capacity. That those includes the clinical providers, case managers, mental health counselors, outreach and education staff, leadership and administrative staff. These internal staff members provide insight into workflow changes, as well as clients' concerns, staffing shortages, and operational barriers. And the stakeholders those external stakeholders influence public health, community acceptance. They include client-sensitive community members served by the Health Services Center, the Alabama Public Health, local community organizations, schools, youth programs that support prevention efforts, faith-based groups, funders, donors who support and care for prevention programs. These external partners help expand services um, service reach, increase awareness, and reduce stigma. Why use the logic module for this assessment? A logic model is used to guide this assessment mainly because it organizes services in a way that it clearly shows resources, actions, and those results. It highlights gaps between input resources that what the clinic needs, and it supports an evidence-based understanding where improvements are needed. It also recommends for rural health assessments due to its structure, visual nature, and it strengthens future planning partnerships and funding applications. Using a logical model ensures the assessment remains systemic and in line with the organization's goals. And the logical model overview inputs and activities. I'm just going to read a few of these. The input resources include the staff, which includes the medical providers, counselors, outreach workers, HIV test kits, STI screening supplies, transportation, housing resources, community partnerships, and then those activities include routine HIV testing, PrEP counseling, prescriptions, condom distributions, just to name a few, and these components form the foundation of service delivery. The logical outputs and outcomes. Some of those outputs include direct health results from activities. That includes number of HIV tests completed, number of PrEP prescriptions filled, STI screenings performed, and then those short-term outcomes, just to name a few, include increased community awareness of availability services, improved knowledge of HIV prevention, and then those medium-term outcomes, just to name a few, increased routine HIV testing, higher PrEP adherence, and then some of those long-term outcomes include reduce HIV incidence in rural East Alabama, improve health outcomes for people living with HIV, and strengthen rural public health infrastructure. Some of the assessment components include community needs analysis, service capacity assessment, identification of gaps, prevention and care, examination of staff levels and resources, determination of community awareness levels. These items form the core focuses areas for the assessment. In the mixed method data collection approach, this assessment uses more of a mixed method approach to gather the appearance data. And why does the mixed method matter in this assessment plan is that rural communities face barriers that cannot be captured with just numbers alone. Stigma, fear, and confidentiality concerns require qualitative explorations. Qualitative data reveals patterns in services use. Combining methods strengthen reliability and validity. This approach provides a full picture of how HIV services function in a rural setting. And quantitative data collection methods. The quantitative data will be pulled from the health services records, which includes numbers of HIV and STI tests performed, number of PrEP initiations, refills, number of condoms distributed, community outreach event attendance, transportation, housing services, utilization, case management, participation. This data provides a more measurable indicators of services reach and demand. And looking at the qualitative data, this will be gathered through those client interviews to understand the various stigma, confidentiality concerns, staff focus groups, community surveys that will look into exploring awareness, beliefs, and HIV and prevention attitudes, partner interviews, which will assess local collaborations and services integrations. So the qualitative findings reveal why behind patterns seen in quantitative data. And data indicated to be measured. This includes the services, access indicators, and just to name a few, it's just wait time from appointments, missed appointments rates, and then the prevention indicators include HIV testing frequency, PrEP initiation and retention, condom distribution usage, and then the awareness indicators include survey scores measuring HIV knowledge, participation in outreach events, and then the client satisfaction indicators include quality of care ratings, reports of stigma and discomfort, perceived confidentiality. These indicators match the health services mission and rural health needs. And why are these indicators important? These indicators were selected because they address significant barriers in rural communities. They measure both services delivery and community perceptions. They provide evidence of improving funding resources allocation. They help the Health Services Center focus on strength prevention and care access. They align direct with recommended rural assessment best practices. And community engagement strategies, some of those include to ensure accuracy and cultural relevance, client and community input will will include listening sessions with community groups, surveys during outreach events, cultural sensitivity messages, anonymous feedback boxes, and then these strategies build trust and ensure realistic assessments of community needs. The rural delivery challenges, just some of these will examine barriers unique to rural Alabama, such as HIV, HIV high HIV stigma due to close-knit communities, poor transportation infrastructure and shortages of healthcare workers, low distance to medical services, lower awareness of HIV prevention options, these, and then concerns about privacy and confidentiality. And these challenges strongly influence service utilization and dissemination plan. And my dissemination plan, and then some of the findings will be disseminated internally through a comprehensive written report from leadership staff, a presentation summarizing key findings, service gaps, staff meetings to discuss implications for those work improvements, training sessions to address identified needs such as prep counseling, just to name one, and then purpose, strengthen internal coordination, and improve services qualities. And then looking at the dissemination plan on an external viewpoint, will be reached through community members, funders, donors, public health agencies, partner organizations. Dissemination products include a plain language community summary, a web page post for public access, technical reports for funders emphasizing resource gaps, briefing for county and state health departments, and goal improve transparency, collaboration, and funding opportunities. In conclusion, is that this assessment plan identifies services in rural HIV prevention, strengthens the health services ability to meet community needs, supports improved access to testing, prep, PEP, and supportive services, provides data for strategic planning and resources development, addresses rural barriers such as stigma, transportation, and workforce shortages, aligns with the health services mission to reduce HIV stigma in East Alabama, and then the health services is positioned to build a stronger, more accessible, and more effective rural HIV response. And these are my references, and that concludes my presentation.